Good morning, everyone, and thanks so much for tuning in today. My name is Callie Berkson, and I am part of the communications team here at the City of Grand Junction. We appreciate the efforts our community has been making in helping to prevent the spread of this virus. Please know that they do not go unnoticed. But we do understand that there are still a lot of concerns and a lot of questions regarding health and safety that need to be addressed. And we have partners here today ready to provide you with some updated information. For those of you joining us on Facebook, again, we will not be answering questions live, but we encourage you to leave your questions in the comments below, and we will address each of them individually. For the media, there will be breakout sessions after this briefing. Today, I am joined by City Manager Greg Caton and Incident Commander for this week, Police Chief Doug Shoemaker. Also joining us today are Mayor Rick Taggart and several representatives and officials from our local hospitals. It's my pleasure at this time to introduce you to City Manager Greg Caton, and he will begin our briefing.
Thank you, Callie, and to our viewers, thank you again for tuning in. We continue to bring you the most updated information regarding this health pandemic. What we've recognized over the last week is not only do we have the health pandemic, but we also have an emerging economic crisis. Yesterday, we brought to you the Economic Development Partners, which provided an enormous amount of information updating you on what's going on in our community. So here's what we have on tap today. We'll first start off with the Mayor, Rick Taggart, to talk a little bit about the city, how our city is addressing this issue, particularly as it relates to the economic stimulus and economic relief that we are planning. Also, our Incident Commander, Police Chief Doug Shoemaker, because it is so important that we continue to focus on essential city services, even as we address other impacts for this health pandemic. But most importantly, we have some special guests today to talk about the healthcare industry, our hospital providers, and how they're addressing this issue. So first, to start us off is Mayor Rick Taggart.
Thanks, Greg. The first thing I'd like to talk about is that we spoke yesterday very briefly about a local state of emergency, and I think it's important that perhaps we spend a little bit more time on what constitutes and why we have a local state of emergency. And basically that grants council the power, which we got together on Monday, and then they in turn grant me the power when there's a situation, it appears, that public health, safety, or economic security is in jeopardy, and we're certainly at this stage. I should point out, though, that our state of emergency was from an economic security standpoint only. And in addition to granting me some powers, it also grants our city manager, Mr. Greg Caton, some significant administrative powers. And for instance, he can also look at our utilities in particular, and as you know, we do water in this community, we do wastewater, and we do solid waste. Greg can take a very serious look at rates during this period of time. He can also look at penalties on delinquencies and reduce those, and interest and reduce those, all in a way to help our community. As an example of that, Greg has already taken the action on wastewater to significantly reduce the monthly fees to many of our businesses that are not operating or operating at a lower level at this particular time. I would remind you on the economic side that council is meeting again this evening. We're taking up another economic issue this evening. An issue having to do with potential jobs, temporary jobs in the community. So I hope you'll tune in for that. As well, I should tell you what's not in our economic emergency. We are not we are not the authority that is going to step into the public health side of things. In other words, if folks are looking to us as the city to declare a shelter in place or a stay at home, that is not our purview. That is a purview of the state and then the county. And if the county, in fact, moves in that direction, you can be assured we will move with them. But that is not the purview of the city. And then last but not least, on the economic side, for those that may not have heard this yesterday. We are in fact doing a tax deferral for all our businesses for sales tax, lodging tax, and use tax for the month of February. Those payments would have been due this past week. For those companies that in fact have paid us, we're doing a rebate if they fill out a simple form with us. For those folks that have not submitted it, you need to submit the documentation, but you do not need to submit a payment of any nature, and that has been deferred to July 31st. That we know will put somewhere between $4 and $4.5 million worth of cash flow back into the community through our businesses, and we hope they will use that to help them pay vendors, and equally, if not more importantly, to keep as many employees on their payroll as they can afford. So thank you very much.
Thank you, Mayor. I would just add one element on the tax deferral. We have received some questions from community members trying to understand if there would be a cut in city services because of this measure, and the answer is no to that. The city has what we refer to as a reserve account, a general fund reserve. It's much like a personal savings account, if you will. And so we have nearly $30 million in that account that we can allow this type of deferral and to help our businesses in a cash flow situation, and then they'll remit those later in the summer. So no cut in city services. Next, we have our incident commander, the city's incident commander, which is our chief of police, Doug Shoemaker.
Thank you, Greg, and thanks for everybody for tuning in to see what we've got to say today. We appreciate the cooperation, the partnerships with the community. I think it's going very well, and it's certainly noticed. So thanks in advance for everything that you're doing. A few quick notes today, really, is first of all, in terms of online businesses and reporting opportunities within the city in particular, we're still open for business, but we have some maybe different methods to do those types of things. So online reporting for crimes, for example, there are ways to do that. Doing your business with City Hall, there are various methods that you can also conduct online business, pay bills, get answers to questions. So we really tell people it's just a little different right now, and so we're making sure we're still available to you, and we want to be a constant resource for that particular matter. In terms of official information, there's a lot of things out there on social media, and it can be a little overwhelming, understandably so. So we tell you to, if you have questions or you want a resource, maybe a central resource where we have that kind of information that's verified and trusted, we'd ask you to come to our website and take a look at those things. We have so many partners we work with in terms of our public health officials, and several other individuals and companies and organizations within the city that are all working together to provide the accurate information that we think you need as a community. So please turn to that page as a good resource. Last, like I've done all week, I want to stay positive on things, and one thing I want to mention is the hashtag GJ Strong initiative that we've looked into, and we're trying to start that trend. So we all know we're making sacrifices throughout this whole instance, and it's challenging for all of us. So what I would ask is that we look to some of the positive things that we're doing within the community, and when we see those positive things happening, take a picture, and if you're on social media, let's start this hashtag trending a little bit of hashtag GJ Strong, and I think it's something that really will show the good things that are coming out of this. We need to work in this together, and we're all partners. So with that, again, appreciate the cooperation from the community and look forward to updating you more. Thank you, Greg.
Thank you, Chief. And as we continue to move through this health situation, it's so important to get up-to-date information. And today we continue to have our partners at Mesa County Public Health, and we have Amanda Mayley here to update us.
Thanks so much. As of this morning, we have started a personal protective equipment drive that's up and running. It was so heartwarming. Speaking of some of the good things that are happening, I've already seen on social media pictures of people dropping off donations. So weekday mornings, you can head over to the Community Services Building on Spruce Street and drop off your donations. There is a specific list of items that we are able to accept at this time, and you can get that exact list. But we know our community wants to step in and help, and it's so appreciated. This is one way you can do that, so that personal protective equipment drive is up and running, and you can drop things off weekday mornings. Testing is still occurring here in Mesa County. The results are coming back on a regular basis. We have a little more than 65% of those results back right now. Our appointment-only screening location is working well. We're getting people scheduled, screened, and through that. So we are getting results back. We do not have any additional positive cases to report today, so our case count in Mesa County does still remain at 5. With that scheduling and screening, there is CDC guidance. So that means not everyone is able to be screened for COVID-19. But that doesn't mean that we don't all have a responsibility to act, to protect ourselves, and to protect the most vulnerable in our community. So I want to share some ways that everybody in our community can act and do something in order to protect our community. So do not go to the emergency room unless that's medically necessary. Wash your hands with soap regularly. Cough or sneeze into your elbow or a tissue. Stay at home when you're sick. Avoid touching your eyes, nose, and mouth, and avoid close contact with sick people. Clean those frequently touched surfaces. These are all in line with the public health recommendations that you've seen: social distancing, keep your distance, stay away from folks. So while we're not going to be able to test every single person, there are actions that every single member of our community can take, and we're asking them to take to protect everybody. The last thing today is we know you have questions, and a lot of them. And forums like this help us answer some of them, but please don't believe the rumors and don't pass them on. There are several sources of reliable, trusted information. Mesa County Public Health's website, the source of that information. Our COVID-19 page has resources dedicated specifically to our response, to what our community members can do. So please, we're asking, we know you have questions. Reach out to us, reach out to our community partners who have been so great in standing up their own websites and Facebook pages. They're finding answers for us as well. But we are asking, please don't pass on those rumors that you're seeing online. Thank you so much.
Thank you, Amanda. Now we transition to our hospital leadership, and we have received questions from community members about the hospitals and how they're responding to this situation, so we're really honored to have them here today. I'll start off with St. Mary's Hospital with Brian Johnson.
Thank you for inviting me today, and I'm happy to talk about what's going on at the hospitals in Mesa County. I'll take a portion of that and turn some time over to the other facilities to talk about what's going on in other areas within Mesa County and their facilities also. I just want to make sure that I want everybody here to understand that we understand that there's a lot going on, and people are feeling a lot of challenges, both from a healthcare perspective and other personal challenges. And I want to assure you that all of our hospitals are doing everything we can to make sure that we are prepared to take care of the people in our communities. We're doing this by collaborating and coordinating all of our activities. This goes around how we deal with our equipment, our staff, and our supplies to make sure that we have the resources we need, not only in Mesa County, but across the entire Western Slope, to make sure we can take care of people in our local communities. One of the areas we spent a lot of time with that I think has been very important and probably the most productive time spent with all the facilities has been engaging in what we call our joint surge planning. This has been done to make sure that we have the resources available in our community. So this includes taking inventory of our ventilator supply, intensive care units across the region, our staff and nursing staff and technical staff, and our medical staff to make sure we can deploy those people where we need them as quickly as possible. A lot of our facilities have been involved in reconfiguring their internal spaces to make sure that we have additional intensive care capacity in our facilities to make sure we can take care of a surge of patients should that need arise. We have been identifying and working with local vendors and alternative vendors for personal protective equipment, knowing that there's a shortage across the country for that. And we've had some good success with that with local vendors across the country. We have been working very closely with our associates to make sure that we're cross-training them and giving them the skills and refreshing the skills that they need to make sure that we can take care of the people with the coronavirus effectively in our communities also. We've also been working hard to operationalize remote capabilities to make sure that we can take care of people as close to home as possible. I want you to know that we are prepared. We have trained people, we continually train people in our facilities. One of the great things about the local facilities in this area is we have taken the dollars that have been entrusted to us by our community and invested them wisely, both in facilities and, more importantly, in our staff, to make sure they have the skill sets necessary to take care of people in this community with the skill sets necessary to keep them healthy as possible. I can't tell you how proud I am of the associates and the healthcare workers in this area, how they've all risen to the challenge and really come together to collaborate. We've seen that not only from our associates and our employees from a nursing and technical standpoint, but amongst our medical staff members. All of these individuals are the kind of people that run into the fire when everybody else is running away, and we're so proud of them, as they take, in many cases, a lot of personal risk to go and take care of these patients that come from all over the Western Slope, which we're seeing happen now with people with coronavirus that are being transferred to St. Mary's Hospital to be cared for in our intensive care unit. Our medical staff and our healthcare associates are amazing people, and we're so grateful to have them here. I want you to know also that all of the hospitals have spent a great deal of time making sure that we have the assets and hard facilities in place to make sure that people are taken care of. We have surge planning in place, we have the associates, and we have the equipment necessary. Thank you.
Thank you, Brian. And now we'll transition to Community Hospital President and CEO Chris Thomas.
Good afternoon. Thanks, Greg. So hopefully you can understand the collaboration that's going on. And so Brian talked a little bit about what we're all doing as far as staffing and resources. Corey's going to talk a little bit on the medical side. But one of the things I hope you all realize is the collaboration that's going on. The Mesa County Health Department is doing an excellent job. We're having daily conference calls. I know the chief medical officers are together on a daily basis. We're talking continuously to make sure that we have the right resources, the right people at the right time. We're working with CMU now that their students are coming back. We're having weekly calls with CMU to make sure they're prepared and supporting them and their needs with their students and their online education. And one of the things that I wanted to talk about is our clinics are open, everyone, and so clinics throughout the organization, both at St. Mary's Community and Family Health West and all the independent clinics remain open. They're trying to do their best to make sure they're kind of staggering. We're having perhaps well visits in the morning and taking care of some of the sicker patients in the afternoon, but please continue to use your clinics. Go there. The federal government is doing a great job of opening up telemedicine opportunities for us. So I think this is going to be a major change that we see not only during this crisis but into the future, is a significant move to telemedicine. So we have the ability to see you at home. If you're not comfortable coming home, or coming to the clinic, if you're one of those that are in a high risk population, please just take advantage of these opportunities. We want to continue to keep you well. There's a lot going on, so please use your clinics. And we want to say thank you to the public for staying away from the emergency departments. We have seen a significant decrease in ED volumes, which is perfect, so we can use those resources to take care of the critically sick and also prepare and be ready for any surges that happen. So thank you for using appropriate facilities, and we'll continue to communicate where and when those are available. I also want to take the opportunity to just thank the tremendous support that we're getting throughout the community, the donations that we're receiving, the cards and the compliments to all of our staff. People are really being gracious. We're screening visitors at the door. We're doing a lot of things that are not normal. People understand why we're doing it, and they're very appreciative of the efforts that we're putting in place to keep everybody safe. The supplies, we've got today, Roosters is bringing food to the staff. We've just had a lot of industry, businesses, and organizations step up and make sure that they're recognizing the healthcare workers and taking care of them. And then I think the last thing I have, and we're trying not to duplicate between the three of us, but we're looking forward. We believe that within the next coming weeks that we'll be able to do some of the testing locally Right now, we're seeing that it's taken anywhere from 6 to 7 days to get results back for the testing that we're doing. We're still going to continue to follow the CDC guidelines on who should be tested and when, but if we can get those services into our community, we should be able to reduce the turnaround to a day or less, and so we're very excited about being able to bring that to the community in the near future. So thank you for your support. Stay healthy, and we'll talk to you soon.
Thank you, Chris. And to wrap up our presenters today, we have Family Health West and Dr. Corey Klein.
Thank you, Greg. We at Family Health West are doing our best to protect our patients and the community as well as our healthcare workers. We are collaborating with the other hospitals to help support efforts, especially if a surge response is needed. So I want to thank the other hospitals for collaborating with that. As a physician, I really want to encourage people to continue to take this disease seriously. I know it's difficult after a week or two of trying to isolate yourselves, trying to distance yourselves, remembering to wash your hands. And I just want to reiterate that those efforts are worth it and that we need to keep it up. Please wash your hands frequently. Please use hand sanitizer. Please stay home if you are sick. Thank you for supporting our healthcare workers. The more of this that we can do, the quicker this will be over, and so it is worth the sacrifice. If you're sick, please call your doctor. We are open. We are giving healthcare out. And the last thing that I would like to say too is because of the reduced activity of the public, blood donations across the state, and especially here in the Western Slope, have been decreased and down. I encourage you that if you are available and you are able, please consider going out and giving blood. Thank you, Greg.
Thank you, Doctor. And so that wraps up today's session. I would just remind to our viewers and give a big thank you to the presenters today. As you can see, we're in good hands with our healthcare providers and experts here in the Grand Valley. Also, on behalf of the community, I want to give an appreciation and a thank you to the healthcare providers. We recognize that they are the ones that go towards the crisis and are supporting us in this measure. So on behalf of the community, thank you to you and all of your staffs. As the doctor had just referenced, we put a call out to the community on how you can help, and that's the blood drive. And so look forward to more information in that regard. Thank you for tuning in today. Again, I'm Greg Caton, the City Manager for Grand Junction.